brightening up our day with your colourful mask. Oh my God, this is all for me. What's going on?
Thank you.
Everyone right to go? Yep. Thanks very much. There are 392 cases across the community today, all locally acquired. 107 of those cases are linked to existing cases or outbreaks, so they're known to be connected to the current outbreak. We now have 3,112 active cases across Victoria. All but 4 of those are locally acquired. 85% of those active cases are under the age of 50. So again, we've said many times that this is everybody's business. This is not just something for the frail aged, as important as that group in our community is, but this is something that is really targeting, if you like, almost those who are not vaccinated. That's the nature of a pandemic of the unvaccinated. That group is still too big for us to be able to open up, but as we slowly decrease the number of people who've not been vaccinated, so get the vaccination levels up and up to hit those 70 and 80% thresholds, we have many more options, of course. That's why it's so pleasing that we had 36,534 doses administered yesterday at state sites. That is the biggest Saturday by quite some margin since we began rolling out these vaccinations. 65.2% of the eligible population has now received a first dose, so we're rapidly approaching that 70% first dose marker, where we have indicated some modest easing will be possible. To go further than that really will be very, very difficult, but we aim to be able to deliver all of those changes that we had indicated a couple of weeks ago. There are only some 92,000 jabs to go before we reach our 1 million doses administered over the 5-week period, so we're running ahead of schedule, and we thank every single one of those Victorians who've been to a state clinic to get the important vaccine. This is all about giving us options, giving us our freedom back, ending lockdowns and getting us to something approaching normal so that we can look to the end of this year and look forward to next year with a sense of confidence and optimism to resume our important work, if you like, repairing the damage, healing some of the wounds of this global pandemic, but also just a year that is very much different than what we have experienced for these last 2 years. Vaccination is absolutely central to that. Now, to that end, we've got some announcements to make today, but can I say that whilst there were 61,000 vaccination bookings made yesterday, a very strong number of bookings, that takes us to 400,000 bookings for the week, which is our strongest week to date. I can inform all of those listening and watching at home that there are 7,000 Pfizer first dose appointments that are empty, vacant, waiting for you at state clinics over the next week, and 11,000 first dose AstraZeneca appointments available at state clinics as well. So if you are minded to play your part to keep yourself safe, to keep your family safe, and indeed to help us in that race to 80% double dose, please go online, make one of those appointments, turn up. If it's an AstraZeneca appointment, then there'll be an experienced clinician to be able to talk you through what that means so you can make an informed choice. As the Chief Health Officer has said many, many times, and all of his deputies and all of us, because logic just tells you this, the best vaccine is the one that's available today. These vaccines have all been through a rigorous process. They're safe, they're effective. None of the people in hospital, no one that's gravely ill has been double dosed, and that's because these vaccines work. They are absolutely effective and safe. There's just a little process to go through in relation to AstraZeneca. I would commend that to anybody thinking about those things today. There are appointments available as we speak. Please go online, make one of those appointments, turn up, play your part, and that step, your actions, will take all of us closer to being out of lockdown, to being opened up, and to having our freedoms back. That's critically important. It also means less people in hospital, because it means less cases across our community. I can also just indicate, of those who are in hospital, there are 147 Victorians that are in hospital. 34 of those are in intensive care, and 28 of those are on a ventilator. Of the cases in hospital yesterday, only 1 was fully vaccinated, and I don't believe that's somebody who's on a ventilator. The key point here is that getting vaccinated works. It is incredibly effective. against the transmission of this virus and against serious illness. There are appointments available. Please go and book one. To that end, we're very keen to take the vaccination program to local communities, to families. And that's why today we can announce a series of pop-ups at 100 priority postcodes, postcodes where there are case numbers, postcodes where there are perhaps not enough people have been through the vaccination program. This will be done in stages. We can't open all of those pop-ups in one day, but there will be significant additional vaccination activity in those 100 postcodes. The first of those are 5 community-based pop-ups. They'll be in areas that need them most, so where the outbreak, where cases are and where cases are potentially growing, so in Hume, Dandenong and Casey. There will also be rolled into this a very significant effort to vaccinate our school kids, but not just school kids but families as well. As you know, we've got a commitment to try and have all of our 12-year-old and up students, all of our secondary students and those grade 6s that are 12, to get them through the vaccination program by the end of the school year. There will be around 70 sites across our 70 schools across our public system where not only students but families, so parents, as well as teachers and staff will be able to go. This is all in addition to the 55 fixed sites that we have. These pop-ups are all about just removing another barrier, taking the vaccination program to you, as it were, so that you can come and be part of that, get your first and your second dose, play your part, get these lockdowns off, and of course protect yourself against becoming seriously ill. The first 8 of those 70 school sites will be in Dandenong, Point Cook, Werribee, Gladstone Park, Caroline Springs, Brunswick and Tarneet, and we'll have more to say about the rollout of those additional pop-up state hubs. In addition to the 55 sites that we have, we've already expanded hours. We've got everything including drive-through sites going. We've been innovative, we've been creative. It's why we've been able to get so many vaccinations done through our state hubs. It was estimated that we do about 25% of the work. We're running at more than 50% of the total work now. AstraZeneca doses, we're now, I think, over the 1 million double-dosed, 1 million Victorians that are double-dose protected via the AstraZeneca vaccine, and the lion's share of that's been done through state clinics. This is such an important part of the overall rollout, and we're delighted to play our part and indeed to do much more than we had perhaps planned on doing. These pop-ups are just another step towards reducing any barriers there might be to being part of this vaccination program. Can I urge people, don't wait. There are appointments available. There are appointments that you can put your name beside today and turn up, play your part, get your first and second dose. This is not someone else's business, this is your business. It's every single Victorian has a stake in this, and putting it off for a few months, that doesn't work. Please make a booking today, and hopefully, just as we've seen last week, 400,000 bookings in a week. Hopefully we can do even more than that in the weeks to come as we look to push beyond the 70% first dose to 70% double dosed, and indeed that ultimate goal of 80%. Now, to talk in a little bit more detail about these pop-ups and some other changes we're making, particularly around opening hours at a number of state hubs, Naomi Bromley's here. I'll ask her to speak next, and then Dan O'Brien, Deputy Chief Health Officer, is here just to take you through the outbreak map, and then we're happy to take any and all questions you have. Naomi.
Thank you, Premier. We know that one of the best ways to address barriers to access is to provide vaccination options close to where people live, close to where they go to school, close to where they go to church, and in other really convenient local community places. Over the next couple of weeks, we're going to be significantly scaling up our pop-up and bespoke vaccination efforts all the way through to the end of the year. As the Premier said, we've already got work underway on 5 new additional community hubs in Hume, Dandenong and Casey, and we've started with our first 8 schools. Now, that school program initially really focused on the students there, but as it rolls out to 70 schools all across Victoria, including regional Victoria, the focus will really be on using those schools as trusted and known community institutions. Those pop-ups will be available to students, staff, families of staff, families of students and other local community members. We'll make it as easy as possible for people to access these hubs. We'll use bespoke booking systems, we'll include walk-up sessions and really try and make it as accessible, friendly and welcoming to those local communities as we possibly can. I'd like to thank our colleagues at the Department of Education and Training who have been doing a great job in helping us identify those 70 schools. In addition to the significant pop-ups that we're talking about today, there's also new opening hours that we're really pleased to announce, particularly in the north and the west. Melton, Wyndham, the Ford factory in Campbellfield, the showgrounds, Broadmeadows Town Hall, all of these locations will move to 12-hour days, additional opening hours, additional after-hours access for people who might be at work during the day, and this is going to make vaccination much more accessible to people in those local communities. I'd really like to acknowledge the staff that have really stepped up and made it possible to increase opening hours at all of those sites. Finally, I'd just like to touch on the VCE Blitz. We're about halfway through now. It's been incredibly successful. We've had lots and lots of young people using that dedicated phone line to call up and make appointments. We know many others had already made appointments, which is fantastic, and many young people are also going to their local GP, which is also great. If you are a Year 12 student or if you're a Year 11 student and you're doing some 3 and 4 VCE subjects, please do call, make a booking, get yourself vaccinated in time for your exam period. Thank you.
Morning everybody, thanks Premier, thanks Naomi. Just to give you a bit of an update on where we are with the outbreak. Yesterday we had, as mentioned, 392 cases. 2/3 of those remain in the north of Melbourne. We had 255 cases in the northern suburbs. And the vast majority of those are in Hume with 137, but the other two large LGAs with a lot of cases are Moreland, which had 49, and Whittlesea, which had 42. There were 14 cases in Darebin and 11 cases in Yarra. About 25% or a quarter of the cases remain in the western suburbs. Yesterday we were reporting 89 cases from that area. 30 were in Wyndham, 19 in Hobsons Bay, 13 in Bringbank, 11 in Melbourne, 7 in Melton and 8 in Moonee Valley. There's been an increasing number of cases in the southeast, but still remains much lower than those first two areas. Yesterday we reported 38 cases from the southeast area, again mainly focused in Casey, 6 in the greater Dandenong area, 4 in Stonington and 4 in the Yarra Ranges and 3 in Port Phillip. So most cases are still localised in the Casey, greater Dandenong and Monash and Cardinia LGAs in that area, and as just to reinforce that it's still much lower than those other areas that we've discussed. There were 5 cases in regional Victoria reported yesterday, 1 in Greater Geelong who was a primary close contact of a known case, 1 in Mildura who was also a known case that had been in quarantine for over a week prior to diagnosis, 1 in the Macedon Ranges, which is related to an outbreak in Melbourne that we'll talk about related to V-Line, and 2 in East Gippsland. And the information is early at this stage, but they are both very low positive tests and may in fact turn out to be false positives. We are further investigating that. If we just run through a few sites of interest around the outbreak. Yesterday we were reporting in an Ascot Vale public housing complex 6 cases identified across 4 households. The Department and Co-Health are on site today for testing of all people there that are potentially affected. We had 1 case in a staff member at the Parkville Youth Detention Centre yesterday. There are a number of close contacts amongst staff, but all the testing and further results will be available today. There's been no impact on operations there. There have been 19 cases in total, half staff, 2 patrons in the KFC in Fawkner. I did mention earlier about V-Line. We've now had 4 cases in total, a further 2 yesterday in further staff members related to drivers and conductors of the V-Line train service. At this stage there won't be any V-Line services running today while further contact tracing is underway. There's a number of cases ongoing in childcare and schools. We've got 19 cases associated with the Yarra childcare in Truganina, 11 cases with the Pearl Street childcare in Glenroy. 5 cases associated with Homestead Family Daycare in Roxburgh Park. But most significantly today, we look like we've got an emerging significant outbreak at the Fitzroy Community School in North Fitzroy. The latest estimates are we've got at least 30 cases involving staff and students, so urgent further investigation is going on into that site to obviously make sure that we get that under control and find out the reasons for what looks like a significant outbreak. There are 2 construction sites that have produced a lot of cases. Panorama in Box Hill with 116 total cases, but pleasingly no further cases yesterday. And this a construction site at 8 Exhibition Street, for which there were 9 cases in total, but no further cases yesterday, which is great. Finally, on testing, testing sites located in the northern suburbs continue to see high demand and wait times. And demand is also increasing in the western CBD throughout yesterday afternoon. So please check websites for case locations and for those locations which have the less wait times so that you can get tested as soon as possible. And in response to yesterday's positive cases in Geelong, Barwon Health had increased hours at their existing sites and established a new testing site at the Geelong Showgrounds. Thank you all. I'll hand back to the Premier.
Thanks very much, Dan and Naomi. Happy to take any questions you have.
Are we seeing the amount of testing in the north and the west that you would expect with the number of cases? Anecdotally, we've heard in Altona and Newport really empty testing sites. Are you pleased with the numbers of people turning out?
Well, look, we'd always want people who are symptomatic to get tested. I've got no advice that says there's a problem with our testing in any part of the city or state, but again, just as we're calling people to go and get vaccinated, as I said before, there's nearly 20,000 AstraZeneca and Pfizer appointments available as we stand here right now. Hopefully a few less since we first mentioned it 20 minutes ago or so. But if you've got symptoms, if you feel sick, you need to go and get tested as soon as you feel sick. That's so important to limiting the number of cases and ultimately limiting the number of people who finish up in hospital. So for your own health, the health of the people that you love the most, but also to make sure that our nurses don't have more work to do than they would otherwise have, please go and get tested as soon as you feel ill. There are many testing sites. I'm more than happy to come back to you in relation to the spread of testing, the number of people that are going through different testing hubs, certainly on a kind of regional basis. But we're very pleased with the overall numbers. And I would just say again, if you are symptomatic in any way, or if you're asked to go and get tested because of your family circumstances, where you've been, who you've come into contact with, please be sure and do that.
When will this first pop-up site be opening, and I suppose how long are you planning for each of them to stay in those locations? I know obviously it'll be variable, but is it going to be a week at each spot before moving on?
The first of them will be opening up in the next few days, and we'll have more to report throughout the week and into the week after, I think. Look, they'll be open for a period of time. It'll probably be a little bit dependent upon how many people book in, what sort of demand there is. The beauty of this is, as pop-ups, we can open them up. They can be there for a week, 10 days, perhaps even less, if we felt that we had, if you like, exhausted all of those who wanted to get a vaccination via that really local, convenient, trusted place. Then we would move on to the next site. There'll be lots of different places for these vaccination clinics to pop up. That's the whole nature of being mobile and being flexible and making sure that we use some of the trusted networks that are there already to really drive these numbers up. This is now all about just the big push to 70% double dosed and 80%, and if we can get beyond that, well then all the better. But all of our freedoms, all of these rules, all of the changes we hope to make in coming weeks and months are all predicated on getting as many people vaccinated as possible, and taking the program to you is just as important as people really coming in very strong numbers to the state clinics that we've already set up.
And where are we getting the extra staff? Where are we getting the extra staff for the vaccination centres? Obviously, testing sites, some of them have expanded their opening hours.
Yeah, look, we continue to draw from a very large number of people who are signed on to do this work. You would note that just a couple of weeks ago we made some changes where students who are able to, they're perfectly qualified to do this. They may not have their ultimate ticket. They may not yet be a dentist. They may not yet be an allied health professional. They may not yet be a fully certified doctor or indeed a nurse, but they have the skills that are required to be part of the vaccination program, and that's why we can expand the program. Again, as I've said, this is a partnership between primary care, so doctors and pharmacists, and they really come into their own quite soon as the number of GP surgeries increases, particularly we hope in the north and the west. as part of some other issues we've been talking about this week. And of course, community pharmacy with the big doses of Moderna that come soon, they can really play an even bigger part as well. So they're doing their bit. We're doing well more than we said we would, but we're pleased to do that, because the quicker we can all get to the 70 and 80, the quicker we'll have these rules off.
Even this cohort you're bringing on, unfortunately, they're not an infinite resource. How much more can we expand our pop-up?
No, they're not infinite, but what I would say is we've had week on week these last few weeks, we've gone increased our state clinics by 25,000, and the most recent announcement I made was to go to a further 40,000. So we've still got some room to push, but it does, as you say, Samaya, it's not infinite. It's not that we can't do 500, 600,000 a week in our clinics at this stage, but we are gradually building, and every week that we're getting high 200s, hopefully pushing through the 300,000 mark, that plays a massive part in getting the state to 70 and 80%, more than we said we'd do, more than I think was expected of us. But that's just the nature of this. We've all got to work as hard as we can. It is absolutely a race, and if everyone plays their part and we get the supply in the right places at the right time, then we're very well placed to get to 70 and 80. Like, to be at 65.2% single dosed, I think we're going to be ahead of the 23rd of September for the 70%. Just like we're ahead, we said 4.5 weeks ago that we wanted to do 1 million doses over 5 weeks. We're going to beat that by a couple of days. So I don't think there's hesitancy out there. I think people are absolutely keen to get vaccinated. But if we can make it even more convenient for them by taking the program to them, then that just means we'll get the numbers up quicker.
Based on staff and vaccination supply, how many of these pop-up sites do you think you'll be able to run at once?
Oh, look, I think we'll finish up with... well, actually, Naomi might want to speak to that. Well, no, she doesn't. She can, so she will.
So at the moment, we've probably got capacity for around probably 8 or 9 at once. And that's all across, obviously, Metro, and there are sort of different things that happen out in regional Victoria as well. That will scale up over time, and as the Premier said, there'll be a point in the program where primary care, general practice and pharmacy will have so much more supply and so many more points of access, and that will give us increased options around what we can do with our state footprint. So instead of continuing to grow mass vac sites, for example, we might keep those stable or even scale them down a bit, and that'll mean we've got more workforce, more resources to get out on the road in the latter part of the year, which will be a really important part of reaching those, final 10%, 15% of people.
And do you have a target, before you leave a school, for example, do you have a target of that cohort that you need to vaccinate to make sure that schools can come back when we're hoping for them to?
No, we don't really have a target. It's really about making it accessible and available for the people who are there and who want to come forward, and giving them the confidence and the convenience to be able to do that. We know that many young people, and in fact 30% of 16 to 18-year-olds have already had their first dose. We're tracking that really carefully because of the VCE Blitz. So we're already seeing young people coming forward, getting vaccinated. So it's really not about reaching a specific target, it is just about making it more accessible to the whole school community, including their families and other people who might live in the local area.
Is 30% high enough, given that we're halfway through this Blitz?
I think it's quite pleasing, actually, and we know that we've got a lot of bookings in our system. We can see those, and we also know that there are a lot of young people who are getting vaccinated in general practice, probably particularly out in regional Victoria. We know that lots of schools and GPs have joined up, formed partnerships, and in regional towns, young people wouldn't want to travel necessarily a couple of hours to come to a state hub, but they will have a local GP in their area. So we're quite pleased with the numbers that are coming through.
And of the 30%, which proportion are from some of those hotspot LGAs?
Oh, I'd have to come back to you on that, but that's the reason why we've got those 8 pop-ups, particularly that the Premier mentioned in some of those LGAs that we're particularly keeping an eye on. Those 8 were specifically selected so that schools in those areas would have, I guess, an added level of convenience during the VCE Blitz.
I don't believe any schools in the Craigieburn area, so on the edges of the Hume LGA, have been included as part of this. Is there any particular reason why, given they're a much younger population, more mobile workforce, and they've also had a lot more cases compared to other areas?
Yeah, so I don't think there's one in Roxburgh Park, which is obviously quite close by. But as we roll into the 70, we're absolutely focusing on LGAs and actually even at postcode level, looking at those vaccination rates in local communities, which obviously will be lower where there are a younger group in places like Wyndham and in Craigieburn, they're great examples. And also those local community pop-ups will be targeting exactly those areas. Just while we're talking about Hume, I would like to call out, the Premier mentioned that there are 7,000 Pfizer appointments and I think 11,000 AstraZeneca appointments. When I looked this morning, there were 4,000 first dose Pfizer appointments available at the Ford Campbellfield site, both walk-up and drive-through. You do need to make a booking, but there are a lot of appointments available there, so I'd really encourage people up in that Northern Growth Corridor to jump on and have a look at the Ford factory there.
Have there been any investigations into whether the MCG would be a suitable place as a vaccination hub?
We have absolutely no limit in terms of people, organisations, communities coming forward to offer locations for us to set up vaccination hubs. It's overwhelming how generous people are. I think there have been some discussions around the MCG. We don't have any plans to announce today. Obviously it would be a lovely thing to do, but we are really very focused on our north and west growth corridors and also down in the southeast as well at the moment.
Given that there's so much support for the MCG to be used as a state-run vax hub, is it something that you are going to look at doing, especially given our supply of AstraZeneca as well?
Yeah, it's certainly one of the options that's on the table and being considered, but we don't have anything to announce today.
When are you likely to make a decision on that?
There are no shortages of ideas about where we can set up state clinics. To Samaya's point earlier on, it's not infinite though. We don't have literally 100,000 people we can call upon to set up clinics on every corner. Our priority is to take the vaccination program where the cases are and to take the vaccination program to you. And that I think the East Melbourne rate's probably pretty high. This is about getting out into local communities. That's what we're doing. We're not opposed to having more sites. But there are limits on how many workers we have. There are limits on just how much we can do. We're already doing roughly double what we committed to do. But if the Commonwealth Government's got a plan to do something there, we'd be more than happy to work with them. But I've just announced today like 100 different postcodes, 70 additional pop-ups. They start now. They'll be starting in the next day or two. We don't have an unlimited resource. We also don't have an unlimited supply. So, look, we're always happy to work together and try and find different opportunities to do things. But I think taking the vaccination program to local communities where there are cases and where there is perhaps not the vaccination level that we would like, that's our priority. Beyond that, we're always happy to work with people. But, when you're doing double what you're committed to do, there are limits. There are limits. And I'm not going to close, just to put it another way to you, I am not going to close a vaccination hub in the outer suburbs that's quite busy in order to have a vaccination blitz in the centre of Melbourne. We're talking about the same people. In fact, arguably we're talking about people who getting vaccinated quickly is even more important where you've got cases. So the north and the west is our real priority. The southeast is becoming a worry for us as well. Taking the program to community, I think, is probably more important than having yet again another mass site right in the centre of town. I would hope that on Friday and on grand final day, our state hubs are full of people who've made appointments, getting vaccinated. Hopefully people will be availing themselves of GP and pharmacy appointments as well. And we can have a massive week, a really big week and a big weekend coming up, but it doesn't necessarily mean that there has to be a site at any one place.
Do you have any more details on the school in Fitzroy that we've heard had defied Chief Health Officer orders to shut down the school to all kids?
No, I don't, but Dan might.
Yeah, look, it's still under investigation. I don't think we've got any evidence of that at this stage. All we know is that it was an outbreak identified. We know there's a large number of cases and we're looking into those cases first and foremost to ensure that they're well and looked after, that their contacts can be traced, and further details from that will emerge, I guess.
How many students were at the school at the time? And
I don't have that information, sorry.
Do you have any evidence of student-to-student transmission or teacher-to-student?
We do, yeah. There's quite a large number of students involved, but but the exact numbers, well, as of this morning, is at least 30, but looks like it's growing from there.
And do you know what our ref rate in Victoria is? There were some reports this morning that our one was tracking at 1.7 compared to New South Wales's, which is at around 1.4, I believe.
That gets recalculated every week, so it was 1.7 before. We'll get another rate early in the week that will give us an idea of how it's going.
Are we tracking, is our speed of weak transmission is occurring a lot faster than what had happened in New South Wales?
No, I don't think that's the case. No, not at all.
The Louis Vuitton store at Crown is listed. Is that because it's click and collect?
I'm not aware of the details of the Louis Vuitton store, sorry.
It would be, you think? Okay.
Do you think?
Yeah, but I'm just saying it's because people have come to that store, but you don't have detail on it.
I don't have further details. So.
Do you think, perhaps, Premier, on that note, do you think the Louis Vuitton store at South Bank is an appropriate store to be open during lockdown?
Well, there's click and collect for retail, and I don't have any details on that particular site. I'm by no means expert on that site. I'm happy to chase it up for you, though.
12 to 15s, it's from tomorrow, 12 to 15-year-olds can be vaccinated?
Well, those pop-ups will become, they will open up as soon as they possibly can. We're foreshadowing it today. They'll be opened up progressively throughout the week. But there'll be opportunities for school communities to make bookings, and we'll get it out. Obviously, 12 to 15, or grade 6 all the way through to year 12. We've got some time to do that, and we want to have that done by the end of the school year. But I'm sure there'll be appointments made very, very soon.
Wasn't it flagged for tomorrow?
I'm not sure. Naomi?
Yep, so access for all 12 to 15-year-olds opens up in general practice system tomorrow and also in our state system. We know that some 12 to 15-year-olds have already been eligible by virtue of a chronic disease or another condition, but that will be available from tomorrow across both the federal and the state system.
How are you balancing the limited supply with opening all these new pop-ups?
So the supply that we have is allocated out by region across the state. So some to regional, different areas of the state, some to metro, and then what's the way that it's kind of allocated to different sites, whether they're fixed sites or pop-ups within that region, is determined in collaboration with the local public health units. So there are decisions that are made about how many doses will go to each site, depending on how big that site is, what the capacity is, what's the size of the local community that it's servicing, and the supply that's used for pop-ups comes from that same pool. So it's a supply that's allocated to a region, to a population, and then there are different service delivery mechanisms that are used to get that into people's arms.
And what sort of numbers are you seeing for no-shows now for bookings?
No shows. Yeah, no, good question. We, at the moment, we're down to, I think, about 1,200 no shows a day. That's all across the system. That it has decreased quite a bit over time, actually, over the past couple of weeks. So it's not a huge issue in our system. What we do at a point in the afternoon with our no shows is we actually sort of flip those appointments. So not the actual appointment itself, but the conceptual dose, if you like, to make another public appointment available. And that's why people do see new appointments opening up, just a few, on a day-by-day basis at each site. Similarly with cancellations, obviously we have cancellations that come through each day, and they're quickly transitioned into additional open appointments that are made available on the website.
So 1,200 a day, what would it have been?
There was a period when it was a bit higher than that. I think the maximum I've seen is probably 800 a day. 1,800 a day. Yeah, I'd have to come back to you on the detail there.
Premier, do you mind if we ask?
Just on no-shows and cancellations, we've had a few, when some eligibility changes were announced, we had some very significant numbers of people cancelling. I just say to people again, as we've said so many times, because it's true, the best vaccine is the one you can access today. That helps us get to 80% faster. It helps us get open, get people back to work, get kids back to school. All of those things are critically important. So please don't delay. Please don't wait for something to occur in a month or two's time. make one of those nearly 20,000 both AstraZeneca and Pfizer first appointments that are available in the coming week.
And where's the government at with the... Oh, sorry.
So I was going to say, how do these pop-up clinics play into reopening schools?
Sorry?
How much does the pop-up clinics targeting schools inform them reopening?
No, well, we want to have schools open before the end of the school year, but our aim is to have the kids vaccinated by the end of the school year. So year 12s, it was very important to try and have as many of them through their first dose as possible to make exams as safe as possible. But the program of trying to vaccinate our kids is, I know this sounds a bit counterintuitive, but it's not absolutely linked to reopening schools because, for instance, as you can see, we've got prep grade 1, grade 2, year 12s back at school in regional Victoria, and we've not yet been able to vaccinate all of those. In fact, the prep 1 and 2s are not eligible to be vaccinated. So they're aligned, if you like, but they're not. It's not a hard and fast thing.
And that was going to latch on to that bit of hope you just threw out to all parents, term for a realistic possibility for sending kids back to school.
Look, I want to get kids back in the classroom as quickly as possible, but what I will say to every single parent, whether it be primary school or secondary school parents, I will not send kids back to school against the advice of the medical experts. I will not do that. Because if I did, that would not be leadership, that would be something very, very different. And it would mean that schools would open, cases would move through schools would close one by one, and in fact I think we would see parents keeping their kids at home because they'd make a judgment that perhaps schools were not as safe as they should be. So we'll get them open as soon as we possibly can, as soon as we've got advice to say it can be safely done, and it'll be a real balance. And I know, look, there's nothing about remote learning that's easy, there's nothing about remote learning that is the preferred way, but we have to be clear about safety. This week, ministers are getting updated modelling from the Burnett. This week there will be many, many hours of meetings to finalise our roadmap in that race to 80%, what can open and when. And I hope to be able to make some announcements in about a week's time that give people clarity as best you can in a global pandemic about all of these rules. But what I can say right now is that all of these rule changes, those prospective changes, the Term 4 issue, all of those things are all predicated on more people getting vaccinated and more people getting vaccinated fast. So there are appointments available. Please go online and book one. Don't wait for someone else to do it. Don't wait. It's not someone else's business. It's everybody's business. And the good news is that people are coming forward. We've had our biggest week ever, 400,000 bookings, biggest Saturday ever. Yesterday, no doubt today will be the biggest Sunday we've had ever. So the program is growing, and people are absolutely making the right call.
Just on education, federal Labor is calling for mandatory vaccinations for teachers. You disagree?
I'll have more to say about mandatory vax in a number of different parts of our workforce throughout the course of this week.
And just back on education.
So I'm just trying to clarify, you're not on board with federal Labor, or you just don't want to tell us yet?
Well, I don't work for federal Labor, I work for the people of Victoria. So what I would say to you is, as I just did, I will have more to say about mandatory vax in a number of different cohorts in our economy, a number of different workforces. I've got no announcements to make about that today, but we've done...
Should it be mandatory for teachers, do you
Well, we've done extremely well in getting so many people vaccinated, frontline workers, across the board. We're at 65.2% first dose, and we're ahead of schedule. We're going to get to 70 ahead of schedule. But to finish the job off, I think that making it mandatory in a number of areas, that's very important. But when I'm ready to make those announcements, I will.
Do you think it should be mandatory for teachers?
Well, when I'm ready to make those announcements, I will.
Just back on the reopening plan for schools.
It won't just be schools, it won't just be teachers, it won't just be nurses, it'll be a whole range of different people.
It's a simple question, though, teachers.
Yeah, and when I'm ready to make the announcement, I will.
Just back on
because your next question will be, well, how are we going to do that? So let's just wait and see. I'll make those announcements as I always have when I'm ready to do that.
Plans to reopen schools. I know you haven't received, you're still waiting on for the modelling, but can you please give people an idea of what it's contingent on? We've obviously stopped chasing zero. Will it be contingent on vaccination plans? Do schools need to improve ventilation before they're allowed to reopen? What are some of those, I guess,
it's a whole range of those things. So just to give you a sense, airflow in schools is very important. So there are some rooms where there is very poor airflow. So the notion of putting air filters into those spaces, that's something that we're exploring, a lot of work going on there. There's also kind of more first principles. The work around modelling is to work out, as best we can, Burnett advising us to say, well, here's the line where cases are going to track. here is your hospital capacity with all the flex and everything that we've built into that. How do you stop those two lines crossing over? How do we make sure that our health system is not completely overrun? The gap between those two lines is the room that we have to move, if you like. The rules that we can ease, the changes that we can make, the opening up that we can bring forward, and the pace at which we can do that. That modelling gets better and better the more data you have. So if you do it a week ago, then you really are speculating. With now another week's data, I'm very confident that we'll receive the first parts of their final report. So they're very close to being finished, and we'll start to receive those reports in the next couple of days. And from a school point of view, you know, we're not. Or shall I put it this way? We are focused on airflow, air filtration. There are a number of things we can do with staggered starts, different parts of the school, a community being on site at different times, all of those things. We'll have a comprehensive roadmap, a blueprint, if you like, in about a week's time. That'll give people a sense of schools, hospitality, where they can go, who they can visit, all of those things. The whole range of issues will be covered off by that. It'll be a caveated document though. It's not, we can't be absolutely certain, but it'll give people a sense of what we're all working towards. And look, you know, I could stand here now and give you a sense of that, but it wouldn't be based on modelling. It'd be based, it'd just be a, you know, I don't think it'd be fair for us just to make things up. We need to have a clear sense. There's a lot of work going on. That's very important, but the modelling is not yet settled, and we'll get that in the next day or two, and that'll mean we've got a much better informed plan, and hopefully one that we can deliver, not just talk about, but actually deliver.
Can you give a sense of what some of those caveats might be? Like, for example, with the hotel quarantine program, at the start of the year, we discovered ventilation was an issue, and we didn't reopen the program until ventilation was fixed. When you announced a semi-roadmap a couple of weeks ago, it was contingent on us reaching those 70% single vaccination doses. Just a bit of a sense around what the caveats are, I guess, what reopening schools are contingent on, essentially.
I think it'll be much more in the, not specifically on schools, but in broader terms, some of the obvious caveats will be how many cases there are, how many people there are in hospital. That'll be the lead issue. So it's all about how many, the less cases we have, the fewer people will be in hospital, the more capacity we have in hospital, the more capacity we have to move and to ease some of these rules. That's why following the rules is very important. We're not chasing zero, but it doesn't mean that people can just do whatever they want and pretend that this is over out of a sense of frustration, understandable sense of frustration. We all share that, but it's not over. It's still going. It's still very real. In fact, the challenge has become even more, it's even harder now. This thing spreads faster and is much more serious for a larger number of people. So we've got to keep these numbers as low as we can. Not zero, but we're not inviting cases, and none of us should, through the choices we make and the behaviour that we exhibit. We should not be inviting infection. We shouldn't be promoting more and more cases. So you can't go and visit your family much as you'd love to. You can't, you know, wear your mask around your chin because you'd like to. We've all got to play our part, do our bit, and that means we'll get open sooner. But probably get tested when you're sick, follow the rules, and then most importantly in some respects, please go and book a vaccination appointment. There are thousands available right now.
The feds have...
Sorry?
What did you make of Sydney's roadmap?
Oh, that's a matter for them. I'm much more focused on the preparation of ours.
But you understand a lot of Victorians would be looking at that and hoping we may be getting something similar, so...
Well, rather than looking at New South Wales, let's all focus on what's going on in Victoria. We're working very hard and we'll have a further set of announcements to make, and that'll be the Victorian roadmap, not the New South Wales one. And look, I wish them well. You can put plans out there many weeks in advance. It becomes a, you know, you just have to see how things go. I'm not sure what modelling they released with their plan the other day. We'll be releasing our modelling. We'll be talking to that in some detail. That work's going to be a very busy week this week, as people would expect it to be, as we get close to that 70% mark, probably exceed it this week. And then
freedoms on that day, the freedoms you've already sort of announced, the relaxing of some of those rules. Would we get that day and date when we hit 70% first dose?
That's what we're all working towards. We're all working towards being able to go from 2 to 3 hours exercise, to be able to go from 5 to 10 kilometres. All those things we announced a couple of weeks ago, we're all looking to do that. And if we can go further in any areas, we will. But that'll be based on advice. But the first thing to do is get to the 70%. And the good news is You know, I'm not sure what number we were on when I made those announcements, but it certainly wasn't 65.2. It's grown. We are ahead of schedule. It'll be before the 23rd of September that we get to 70. We just have to wait and see what case numbers are at that time as well, but it's our aim to be able to deliver on those commitments, and if we can do more, we will.
You said if you can do more. Is there a chance you could do less, given the outbreaks in construction?
No, I think, well, look, put it this way. We're aiming to deliver on all of the commitments that we had foreshadowed. I don't have a crystal ball. I can't guarantee that, but that's what we're working towards. What I think makes it more likely is if we reach that 70% faster. So the only way to do that is for people to book appointments. Take one of those 11,000 AstraZenecas or one of those 7,000 Pfizer appointments. 4,000 Pfizers at the old Fort site in Campbellfield. Hopefully there's literally a queue forming as we speak.
Are you not troubled by the outbreaks that we're seeing in construction and what it might mean for
the construction sector knows, and very clearly, it's a very diverse sector. There's many different component parts to it, and it's an interdependent supply chain in many respects, but they know and understand that they have to follow the rules. We have to see these cases come down, and we'll have more to say about both getting vaccinated and following the rules and getting these cases down. Pleasingly, there's no new construction outbreaks today, but that industry, as Martin Foley I think's made it very clear, you know, they need to take very seriously what's going on in that industry, and there has been, I think, some compliance issues, and we've seen some cases. They've got to be very vigilant.
On vaccination, another million Moderna jabs. How are we positioning ourselves to get a decent share of that?
Well, I think Moderna's the primary platform for the delivery of Moderna is our community pharmacy network, and I know many community pharmacists. I know the Guild very well and have worked with them for decades now. So I'd be very confident that they will get those jabs into arms. Very trusted. It'll be very easy, convenient. You know, go and visit the local chemist, get your first dose Moderna, your second dose. It's a very, very good outcome.
What share of that million would be fair for Victoria, do you think?
Well, I think a pro rata share would be good. So what, just 26%, something along those lines?
Not above that, given New South Wales was prioritised?
Well, no, I think we've seen some. I think we'll very soon see some announcements about some additional doses coming from the Commonwealth Government, and it'd be my intention through these pop-ups and other decisions we'll make to push them into the north and the west, where we've got the highest number of cases. I won't so much go off the speculation in one of the papers today. I'll wait till the Commonwealth Government actually pick up the phone and announce or tell us. But hopefully there are many hundreds of thousands of extra doses coming to Victoria. That's what we're owed. That's the fair and equitable outcome. A national vaccination program needs to make sure that everybody across the nation gets through that. You know, everyone has to get vaxxed through that national program.
On that note, do we have enough pharmacies and GPs, especially in the north and the west, already onboarded by federal authorities, or do we need more? Does it need to ramp up?
I'd always encourage more, and I think that's what the Commonwealth Government's doing.
Do you think that they've been too slow to act, though? Plenty more GPs and pharmacies in that southwest in Sydney have been onboarded quicker.
Yeah, well, again, we can't change that. We can only, hopefully with a sense of urgency, see the Commonwealth Government accredit more and more points of presence, as they call it. We've opened additional state hubs. We haven't wasted any time. I'd hope the Commonwealth Government follow the lead that we have given them. Get as many points of presence as possible, get as many jabs into as many arms. I've canvassed these issues at length this week. There's not much point going back over it again. People know where I stand. A pro rata allocation is critically important, and if you're behind, then there needs to be a catch-up. There needs to be a make good. There needs to be a square-up for the fact that some doses that should have come to us went elsewhere.
Since we overhauled our contact tracing, we've essentially been meeting and far exceeding the national benchmarks for, contacting cases within 28 hours and PCCs within 48.
Yes.
Do you have the latest on what that percentage is at the moment and what it was at the start of lockdown 6.0?
Oh, I don't have it to hand, but we can try and get you. I'm not sure whether Dan has it. Oh, he does. There you go.
Thank you very much.
Something I worked up a little earlier.
Thank you.
Yeah, we've got 99.7% of cases are contacted within 24 hours of notification, and 99% of PCCs or close contacts are contacted within 48 hours of notification.
And that's remained relatively stable since the start of the lockdown?
I don't know, to be honest, what it was at the start of the lockdown, but it's pretty hard to get much better than that. So I'd say, if anything, it's better, but certainly very pleasing, because it still is the most important thing is that people find out as soon as possible that they're positive and that they're looked after, because we always have to keep in mind the fact that this is a serious illness, so we want to make sure people have access to the best care and support, but then also making sure especially their families, but also their close contacts know and hopefully isolate and get themselves tested as soon as they can. And I just wanted to mention before that, in fact, 50% of our cases are coming from known households. So what we're seeing with this strain of the virus is that basically it's very hard to protect everyone else in your household from getting it. Once you've got it, it's a very high household attack rate. So the figures are higher than they might have appeared last year, for instance, because last year we could often protect the other members of the family, but being so infectious within the household, it really does spread very quickly through.
There were some concerns that the contact tracing system may have been overwhelmed. The DHHS website, for example, doesn't list all of the exposure sites anymore. Would you say it has been overwhelmed?
No, I don't think it's been overwhelmed. I think it's certainly been challenged, and we've had to absolutely adapt what we've been doing from 2 months ago and make things more efficient and streamline processes, but we're still, as you can see from those statistics, getting to the most important things in a really quick time. As far as exposure sites go, it's two things. One thing is that we notice over time, as you learn more and more from the outbreak, that there are certain exposure sites where really transmission doesn't occur, so we now want to focus our energies and attention on the really high-risk places, so therefore we're less using some of those lower-risk places. And second of all, if you have huge numbers of exposure sites on websites, the important ones tend to get lost. So it's really about trying to really focus our energies on where we think the most important interventions can be made.
And the Boxing Day test, obviously a couple of months away, but given the England-India test was cancelled because of a COVID outbreak within a team, how important do you think biosecure bubbles will be for this summer's Ashes?
Look, I think it's still a fair way away. Things are moving very fast, as the Premier said. I mean, I think the landscape's changing. There's experience we're learning also from overseas. I'm not sure what it'll look like, the Boxing Day test. All I hope is that by that stage we have a very large percentage of our population vaccinated. The risk will be very much more mitigated. And what I do know is the vaccine works, and it saves lives, it prevents transmissions. With this outbreak, although the numbers have been slowly climbing, there's absolutely no doubt that the vaccine's having an impact on that, and that it's not climbing as fast as it could. I think if you look at the case numbers, 15% of them are over 50, that's all. If you look at last year, by far the majority of cases were in older populations, and so it shows you why is it not affecting older populations, because they've got the highest rates of vaccination, so I think it's key.
Just on contact tracing, one for the Premier, just on contact tracing, Kate Matson said yesterday that it was her understanding that every positive case was getting a call from the department within 24 hours of getting that result. We know of two people who have tested positive. One took 4 days to get a call from the department. Another took 7 days after getting a call from the lab to then get a call from the department.
We've just had the Deputy Chief Health Officer report those numbers to you at 99%. So perhaps it's a question best directed to him, but if you want to give me those examples, I'll chase them up.
What's your reaction to that? Waiting for a week?
I'll confirm what's going on first before I react to it, Paul, if that's okay.
You doubt it's
No,
happening?
I'll confirm what's happened first before I provide you with a reaction. 99% of people are being contacted, as the Deputy Chief Health Officer has just said. Everyone's doing their very best to get to people as fast as possible, to get them the information that they need, to support them as well. That hasn't changed, whether it's 10 cases or 400 cases a day.
What's an acceptable time, do you think?
Well, there's a National Cabinet benchmark, and we report against that, and we are well in excess of that.
What do you think is an acceptable time?
Well, there's National Cabinet benchmarks, and we report against those, and we are, if you look at the National Cabinet Common Operating Picture, it's all green, because we are delivering against all of those. On specifics, I'm happy to chase it up.
What do you make of the entire V-line network essentially being crippled by a single infection?
Well, that's the nature of the Delta variant. It spreads so fast, and when you've got to furlough staff, we talk about household attack rates. Workplace attack rates are very high too. If you work with somebody who is positive and they happen to be through no fault of their own at work during a very infectious period, then Now, that's why today we have literally coaches replacing every V-line service. We'd much prefer it wasn't the case, but you can't ignore the fact that it's got into that system. You just have to work as hard as you can to support those people through testing, and they'll have to isolate, and we'll get services back up and running as soon as we can.
Does it indicate, though, that V-Line's COVID safe plan may have been a bit substandard? If this has
No,
been
I don't think so. I think if you were to say that, just look at the number of infections we've got, and many of them are in places where people are doing the right thing. They're trying as hard as they can, but this is it's a pretty challenging thing we're up against here. This thing spreads much faster than last year's COVID variant, or the COVID-19 virus in its original form. It spreads fast. It grows really quickly. It puts more people in hospital. It's a different enemy, if you like, a different challenge. So I wouldn't read that into it. It just means that it's got into the system, and you have to have a pretty broad and, if you like, conservative approach to who gets taken out, who has to stay at home for the 14-day period.
And it's allow those to stay in Melbourne overnight, particularly in the northern and western suburbs?
I'd probably need V-Line to come back to you on exactly what processes they had in place. These services are running. It's not like there's coaches replacing trains. We're still going to get people where they have to go. It'll take a bit longer, and we apologise for that, but this is a global pandemic, and this thing spreads really, really fast. And you can take all the precautions in the world. I'm sure that many people who have caught this virus would tell you stories about the extraordinary precautions they went to, the fact that they've tried at all times to do the right thing, and still they've been able to catch this. It is a wildly infectious disease.
Is it possible to scale back metro services and rescale back the metro services and get metro drivers to be driving V-Line trains?
I'm sure that our public transport team will be looking at all the different options to try and return services to regional Victoria as quickly as we can and as safely as we can. Minister Carroll was out on Friday. If he's got to come out and speak to you again at some point, I'm sure he will. But we're all focused on doing what's safe and getting people where they want to go, and that means it's coaches replacing trains today.
Any chance you were barracking for Port Adelaide last night, given now that we've got two very proud Melbourne teams in a grand final in Perth? It's a bit of a kick in the guts again.
No, surely you wouldn't accuse me of barracking against Victorian teams.
In a jovial manner. What do you make of having two Melbourne teams playing the grand final in Perth?
Look, it's fantastic that we've got two Melbourne teams playing in the grand final. The fact that they're not able to play the grand final here, that's obviously, that hurts all of us. We'd much prefer to see the grand final, regardless of who was in it, played at the mighty MCG, but it's not safe for us to do that. So, as I've said many times, footy is an important part of our character. It's a soulful thing. It means so much to our city and our state. But no game of footy is worth putting people in hospital. So, it's being held in Perth. Hopefully it doesn't need to be held in Perth again. It can come back where it belongs.
And who are you barracking for?
Sorry?
Who are you barracking for?
I haven't studied the field yet, but I was out at the Western Bulldogs the other day, and they've kind of thwarted my team's progress. So
great
perhaps...
choice.
It's a great choice, you say.
Choice.
Oh, very good. Look, it'll be a fantastic game of footy. We'll have to watch it from a distance. Hopefully we won't have to do that again next year.
Just one final one about support payments. There's a $1,500 support payment if you're a household contact of a positive case.
Yes.
What happens if the timeline there resets, if another household member, for instance, then tests positive and your timeline resets for another 2 weeks?
Oh, I'm not sure the answer of that. I'm not sure of the answer of that, but it's based on need. So if you've got the need, then we would make the payment. I think that's what I would expect to happen. But I'm more than happy.
Payment.
Well, if you have got to isolate for if it's 4 weeks ISO, then you'd get 2 lots of the $1,500 payment. This is all for people who don't have sick leave or other reserves that they can fall back on. So there's 2 payments. There's a $450 payment for those isolating, waiting for a test result. And then there's a $1,500 payment for those who've got to do the 14 days. I would assume, and I'm happy to chase it up if you give me any details of anybody, if you were to qualify for 2 of those payments, you would get 2 of those payments. And there's probably people, I dare say, across the last 20 months who have got those payments more than once. Your question is, what if it's consecutive? I don't think there'd be a problem with that. That's the aim. It's meant to make it easier for those workers and those families to do the right thing by all of us and stay at home and not contribute to the spread of the virus. And given the completely toxic nature of insecure work across the Victorian economy and the Australian economy, you have to respond to the fact that many people don't have leave. If they don't work, they don't get paid.
On another issue,
Yes.
Premier, you might be aware that 4 people, including children, died in road-related incidents this weekend. Do you have any safety messages for Victorians, particularly as we look forward to the school holidays?
Look, I just obviously send our deepest sympathies to the families of those who have passed away this weekend. We're all very focused on a global pandemic, as we should be, but business as usual. Lots of other parts of government, lots of other parts of public service that are just as important. I know Victoria Police are out there, they're doing their very best, but it is for all of us just to slow down, getting where you need to go. If it's a few minutes later but you arrive safely, that's the main thing. Well, obviously we send our best wishes to those families. This will be an incredibly difficult time for them. But just because we've got rules on, just because there's perhaps less traffic on the roads, doesn't mean that they're less dangerous. That's a bit counterintuitive, but it's true, and we've all just got to be focused on those basic things: seatbelts, fatigue, speed, and making sure that we're never behind the wheel if we've had too much to drink. And for those who take drugs, you can't be behind the wheel if you've been involved in that sort of activity either.
The Prime Minister's just talking.
That's not a comment on those particular incidents, but I'm just more broadly, we can all play a part in getting to where we need to get to safely if we just follow those basic rules. But to those families, we send our deepest condolences.
Premier, the Prime Minister's just confirmed 400,000 doses going to Melbourne suburbs in like a 3-week blitz. Is that essentially what this is being announced today?
No. That'll be in addition to what we're announcing today.
Were you given a heads up on that before it was announced?
No.
Were you expecting a heads up on that before it was announced?
Well, it's hard to know what to expect, really, isn't it? I didn't expect that hundreds of thousands of doses that should come to Victoria would have gone to Sydney. They did. This is fantastic news. Maybe while I've been talking to you, there's a missed call on my phone. I don't know. Let's not argue about who said what to whom. Let's get jabs in arms. That's what I'm focused on. Always have been.
You just found out now.
Yes.
Yeah. And 400,000, that's
apparently
enough?
how our national government works these days. But anyway, I'm delighted to know that. That's fantastic news. That's fantastic news.
Thank you.
Let's get them into arms. That's what I'm about. And maybe if they'd been ordered last year, we'd have them in arms already. Thanks very much, everyone.